Hello everyone, welcome to Study Race. Today, we are going to study about gonorrhea, which is also known as Clapp's disease. It is actually an acute infectious sexually transmitted disease of mucous membrane that affects genitourinary tract, eyes, etc. It is a venereal disease, name employed by Galen. It is characterized by lesions of mucous membrane of urinary organs. When gonorrhea was first known as a disease, medical knowledge was limited, and treatment options with often painful, with little or no improvement. One of the early treatments for gonorrhea in males involved clapping both sides of the penis at the same time in an attempt to push the pus and discharge from the urethra. The picture shows causative organism of gonorrhea. It is a sexually transmitted disease. It is caused by bacterium Neisseria gonorrhea, which we saw earlier. The incubation period for this bacterium is generally 28 days. This bacteria grows and multiplies quickly in moist, warm areas of body like cervix, mouth, urethra, or rectum. Let's take a look at how it spreads. It is transmitted through direct inoculation of infected secretions from one mucous membrane to another. It spreads during vaginal intercourse, oral intercourse, and anal intercourse. Also, it can spread from mother to child during birth. Let's have a look at pathophysiology. Neisseria gonorrhea travels due to the reasons discussed before. It gets attached to pili to columnar epithelial cells of urethra. It then produced marked polymorphonuclear response in submucosa. Leukocytes exudates fill up the anterior urethra. Inflammatory process extends to the posterior urethra. Granular tissue forms in mucosa and submucosa. Lastly, it comes with urethral discharge. Clinical manifestations in males include painful and burning urination, conjunctivitis, mucus discharge from penis, inflammation in foreskin, pain in testis, mouth sores, throat sores. Whereas in females, symptoms are painful and burning urination, conjunctivitis, a yellowish vaginal discharge, redness and swelling of genitals, burning or itching of vaginal area, excessive bleeding during menstrual period, painful intercourse, lower abdomen pain, bleeding after sex, etc. If the infection is in rectal route, symptoms will be like pus-like discharge, pain, constipation, bleeding. It can be diagnosed through various ways. Here are 3 tests used to diagnose gonorrhea: bacterial culture, Gram stain, and nucleic acid amplification test, NAAT. Knowing is half the battle. Prevention or non-pharmacological management include use condoms, limit number of partners, test for STIs before sex, regular gonorrhea screening, abstinence, safe and protected sex. Be prepared, not scared. Whereas in pharmacological treatment, antibiotics like ceftriaxone, cephalosporins, penicillin are given. But for severe infection, combination of ceftriaxone, doxycycline, and ciprofloxacin is given, or erythromycin, 1 gm oral, is given. In summary, this video provides comprehensive information on gonorrhea, a sexually transmitted infection. It emphasizes the importance of getting tested and discusses the symptoms, diagnosis, treatment, and prevention of gonorrhea. It also highlights the severe long-term complications that can arise when left untreated. The video stresses the importance of safe sex and provides helpful resources for more information. In the end, I would like to thank everyone and hope that you have found this video informative.